It's a first of its kind hub in Canada that takes a holistic approach in providing healthcare to patients. And the answer isn't always medication. It's called social prescribing.
What could happen if your doctor prescribed nature or community or time in a knitting group instead of pills?
The model was first started in the United Kingdom, and now the Canadian Institute for Social Prescribing has launched it here in Canada, an approach that takes social determinants of health in consideration.
We're really talking about the things that drive health outcomes in a very profound way. It's where people eat, the air they breathe, where they sleep, whether they have housing or not, the sort of jobs they have, and the kind of relationships and connections and supports that are in place.
Canada's current healthcare system doesn't always take these factors into account, and these inequities and disparities became even more pronounced during the pandemic, disproportionately impacting marginalized communities and their health outcomes.
We're kidding ourselves, and it's a very cruel joke that too many communities have had to face time and time again. And I think what we really need to see in modern medicine is this push towards embracing and implementing and integrating the social determinants of health in a way that we just have not done before.
And that's exactly the Institute's goal, connecting patients to community health centers and services, saying this approach will ease the burden from the stretched healthcare system and improve people's overall health.
Move away from asking what's the matter with you and start asking what matters to you. If you're experiencing food insecurity, maybe you need to be connected to programs that help build nutrition skills, but also provide access to healthy foods.
This summer, the Alliance for Healthier Communities launched the first Black-focused social prescribing project aimed at improving the health in Black communities, grounded in Afrocentric principles of well-being.
The social prescribing model works because all community health centers have had this connection, right? Because we have an interdisciplinary approach. We have primary care and community programs in one as a one-stop shop. Principles like nothing without us, about us, kind of a value and principles.
The project comes years after the Alliance launched a pilot social prescribing initiative across 11 health centers in Ontario. 147 providers helped to connect over 1,100 clients to nearly 3,300 social prescriptions, and they saw immediate impacts.
The reduction of isolation, better connectivity, and increase in social activities. There was a reduction of emergency department visit. I think it's about 14% decrease in emergency department visit. That's significant.
During the 2-year project, community health centers are looking to track more data to measure the impacts of this model, also hoping governments and policymakers will take notice of the benefits. For City News, I'm Faiza Amin.